Good morning, good afternoon, good evening, wherever you are when you're watching this. This is Howard Goldman from Cleveland, Ohio, Cleveland Clinic, and I'm very happy that you've joined us for this industry theater about macroplastique, tried and true. Now, some of the tips and tricks for injection. So we often do a urethral block first, and that's very simple. We just inject a little lidocaine perimeatally at the 4 and 8 o'clock position. We try to set up all of the injection material prior to the injection, use a short-beaked injection scope, which we'll come to in a minute. And also, since there is a little bit of learning curve as to how to do this, though I like to do these in the office, but I would recommend doing the first few in the surgery center or something like that, and then once you get it down, transferring it to the office setting. So this is the actual injection device. Here's the needle, here's the material, and then you just set it up with this injection device, which as you squeeze it, it provides the pressure that pushes the macroplastique out. Now let's look at a short video that goes over some of these points, and you'll see this is just a model, so I'm not wearing gloves, but let's take it away. You'll need a scope. One very important thing to tell people who are learning how to do this is it's critical to have a scope with a small beak. So this is a special injection scope that can be used for bulking agents, can be used for Botox, things like that. But the beak is very short. So essentially where the lens is and where the water comes out are very close to each other. If you use a regular scope with a regular beak, the beak goes back to about here. And so what happens is the water's coming in here. And so if you move to the mid-urethra or beyond the mid-urethra where you would be injecting the macroplastique, the water flows actually outside the meatus, and thus you don't get distension of the urethra. So always use a short beak or a special scope. Now we're going to go ahead and take the macroplastique out. So we'll open it there. It's always doubly wrapped. So that's ready. Now we'll open the needle. And again, there's a special needle which is utilized for this. You can't utilize other types of injection needles that are utilized for, let's say, Botox, because with this material and device, this is very, very viscous, so it takes a lot of pressure to get it to flow. And so they have a metallic needle. And so putting this all together, essentially we go ahead and put the syringe through that. We then let the back part press on this button, let that fall back, and we line up the dots with the opening there, put it in, and then give it a twist. So now it's in securely, and then we attach the needle. And it's important to attach the needle very tightly because it's so viscous that if you don't attach it tightly, as you start to pump it, there's a lot of pressure that's needed because of the viscosity, and it'll actually start to work itself around the threads and come out here if it's not done tightly. Then we prime it. So give it a few pushes till the material's at the end. There it is. Now we have to push this button back here to sort of hold off on the pressure. Now we're ready to inject. Now some people in real life do that priming part once it's in the bladder and you can see the tip in the bladder. So now we take our scope, we make sure there's the nipple on the end that we're going to pass the needle through. We close that outflow tract. You then go ahead and put the needle through the opening here and pass it till you can just about see it coming out the tip. And then for the real world and what we'll do in the models, you kind of back it up so it's back in the scope. And then we're going to hook a light cord up, and then we're going to place it in the urethra. So we're now going to place the scope into the bladder. Again, then we'll insert the needle. And then you'll see there are some marks on the needle. There's the first one, that's about 1/2 centimeter, and there's a second one that's another 1/2 centimeter. So what we're going to do is we're going to sort of see how the needle lays within the urethra to determine where we actually do the injection. So theoretically, if you want the bulking to be in this area of the urethra,
I'm going to put the needle there and then back the scope up. So there's the first mark and there's the second mark. So what I know is that I want to kind of inject into the urethral lining somewhere around this area, and that'll put me at the proper area from the in the urethra, just beyond the bladder neck is where we want the bulking to occur. Okay, so now we're actually going to inject. We're going to start with the bottom one over here. So we'll go in at about a 30 to 45 degree angle. And then once we get to the first black mark, which is there, we'll bring it out more to a 0. Then we get to the 0, or the second black mark, we can start injecting. So now we're going to inject. So you see that little bulge occurring. And that's what it's supposed to look like, where it starts to fill that area. Okay. And after 30 seconds, you also push the button here to take the pressure off. Wait 30 seconds, and then you withdraw. Okay, so we've got the nice one there at the base, and now we're going to go to the side. And it's a little harder to see the side, but there we kind of went in at the angle. There's the first one, now we make it even, and now we go to the second one, and let's see what happens now. So you see how that's kind of bulking? So this is actually what our lateral bulking just looked like.
So wire macroplastic, again, as I noted earlier, this has been around for a long time. It's got a good track record with a nice cure and improvement at mid-long-term outcomes. Migration has not been seen, it doesn't degrade, and you get a stable response. This can be done either in the OR or, as I preferred, in the office.